You probably think you're doing something good for your body every time you reach for a piece of fruit. It feels like the safe choice, the light choice, the choice no doctor would ever warn you about. But if you live with reflux, that exact habit might be quietly working against you day after day without you ever connecting the dots. The orange juice you drink with breakfast, the pineapple chunks in your smoothie, the tomato sauce on your pasta that you never think of as a fruit at all. Any one of these can reopen the same irritation your body has been trying to calm down since the night before. And the frustrating part is that the burning rarely shows up right when you eat. It can creep in an hour later, sometimes longer, long after you have already moved on and forgotten what triggered it. So you blame stress, or a bad night of sleep, or simply getting older, when the real explanation has been sitting on your plate the entire time. This is one of the most common blind spots in people managing gastroesophageal reflux disease, known medically as GERD. Fruit has a reputation that is almost untouchable. We are taught from childhood that fruit is the safe alternative to processed food, the snack you reach for instead of guilt. And for most digestive issues, that reputation is well-earned. But reflux is not most digestive issues. Reflux is a mechanical and chemical problem at the same time, and certain fruits, specifically because of their acidity and their composition, can aggravate that problem directly. Today we're going to walk through exactly why that happens, which fruits tend to be the biggest offenders, why your symptoms might be inconsistent and confusing, and what you can actually do about it without giving up fruit altogether. Let's start with what is actually happening inside your body when reflux occurs, because understanding the mechanism is what allows everything else to make sense. At the bottom of your esophagus, right where it meets your stomach, there's a ring of muscle called the lower esophageal sphincter, often shortened to LES. Think of it as a one-way gate. Its job is to let food and liquid pass down into the stomach, and then close tightly behind it, keeping stomach acid where it belongs. That gate has to manage an enormous pressure difference. Your stomach is a highly acidic environment, with a pH that can sit between 1 and 3, acidic enough to dissolve food and kill most bacteria. Your esophagus, on the other hand, has a delicate lining that was never designed to handle that level of acidity. When the LES is working properly, this difference is never a problem. When it weakens, relaxes at the wrong time, or simply does not close completely, acid escapes upward, and that is reflux. Now here is where fruit enters the picture, and it enters in two distinct ways. The first is acidity itself. Many fruits, especially citrus fruits like oranges, lemons, grapefruit, and limes, are naturally high in citric acid. When you eat them, you're introducing additional acid directly into a digestive tract that may already be struggling to manage the acid it produces on its own. If even a small amount of that acidic content makes its way back up through a weakened LES, the irritation to the esophageal lining is more intense than it would be with a less acidic substance. This is why so many people notice that orange juice in the morning seems to set the tone for a bad day, even if they cannot explain why. The second mechanism is more subtle, and it involves how certain foods affect the LES itself, independent of their direct acidity. Some compounds found in fruits, along with certain eating patterns associated with fruit consumption, such as drinking large volumes of juice quickly or eating fruit on an empty stomach, can actually cause the LES to relax at moments when it should stay tight. When that muscle loosens even slightly, it creates a window of opportunity for stomach contents to travel upward. So you're dealing with a kind of double exposure. More acid is present, and the gate meant to contain it is more likely to open. Tomatoes deserve special attention here, because botanically they are a fruit, even though we treat them like a vegetable in everyday cooking. Tomatoes are highly acidic, and they appear in our diets constantly, often in concentrated forms like sauce, paste, or ketchup, where the acidity is intensified rather than diluted. A bowl of pasta with marinara sauce may seem like comfort food, but for someone with reflux, it can be one of the more provocative meals of the week. The combination of tomato acidity, added fat from cheese or oil, and the simple volume of food consumed in one sitting creates ideal conditions for symptoms to appear later that evening. Pineapple is another fruit that frequently surprises people. It is naturally acidic, but it also contains an enzyme called bromelain, which helps break down protein. While bromelain has some legitimate uses in digestion and inflammation, in the context of an already irritated esophagus, it can increase sensitivity in the lining, making existing irritation feel worse. People who enjoy pineapple in smoothies, on grilled dishes, or as a dessert often report a delayed, burning sensation that they struggle to trace back to the fruit itself, precisely because the discomfort does not arrive immediately. This is a good moment to mention something important about how reflux symptoms behave in general, something that explains a lot of the confusion people feel. Reflux is not always immediate. Stomach emptying, the layering of different foods, body position after eating, and even how quickly you ate can all shift the timing of when symptoms appear. This is part of why so many people walk around for years without realizing that a specific food, like their favorite fruit, is contributing meaningfully to their condition. They're looking for an immediate cause and effect, when the real pattern is more delayed and more cumulative. If you have made it this far, you are clearly someone who wants to actually understand what is happening in your body, rather than just guessing at home remedies that may or may not work. That is exactly the kind of viewer this channel was built for. And if that sounds like you, take a moment right now to subscribe and tap the like button. It genuinely helps this kind of medically grounded content reach more people who are dealing with the same confusion you might be feeling right now, instead of sensationalized content that promises miracle cures and delivers nothing. We will continue right where we left off. Let's talk about grapefruit specifically, because it tends to be treated as the healthiest option among citrus fruits, and in many contexts it is. Grapefruit is rich in fiber, vitamin C, and antioxidants. But for someone managing reflux, grapefruit can be one of the more aggressive triggers precisely because of how acidic it is, often more acidic than orange. People who eat half a grapefruit at breakfast, thinking they're making the healthiest possible choice, may be unknowingly setting up hours of discomfort that they later attribute to stress at work or a poor night of sleep. Lemons and limes function similarly, though most people do not eat them whole. The issue tends to come from lemon water, a habit that has become extremely popular as a so-called detox or digestive aid. The irony is significant. Many people start drinking lemon water specifically because they believe it will help their digestion, when in someone with existing reflux, that same lemon water can introduce a meaningful acid load first thing in the morning, before the stomach has had a chance to settle from the night's fasting period. This is a clear example of well-intentioned advice that simply does not apply universally, and it shows why generic wellness trends can backfire when applied to a specific medical condition like GERD. Apples occupy a more complicated middle ground. Most apple varieties are lower in acidity than citrus fruits, and many people with reflux tolerate them reasonably well, especially when eaten in moderation and not on an empty stomach. However, apple juice and certain tart apple varieties can still provoke symptoms in sensitive individuals, particularly because of their natural sugar content combined with acidity. This matters because fructose, the natural sugar found in fruit, can ferment in the digestive tract under certain conditions, producing gas. That gas increases pressure inside the stomach, and increased internal pressure is itself a mechanical trigger for reflux, independent of acidity. So even a relatively gentle fruit, eaten in large quantity or alongside other gas-producing foods, can contribute to symptoms through this indirect pathway. This pressure mechanism is worth sitting with for a moment, because it explains why portion size matters just as much as fruit selection. A small serving of a moderately acidic fruit, eaten slowly and not on an empty stomach, may cause no symptoms at all. The same fruit, eaten in a large quantity, blended into a concentrated smoothie, or combined with other fermentable foods, can produce enough internal pressure and gas to push acid upward even if the fruit itself was not particularly acidic to begin with. This is why two people can eat what looks like the same fruit and have completely different experiences. It is rarely just about the fruit. It is about the fruit, the quantity, the timing, and what else is happening in the digestive tract at that moment. Berries are a category that often gets overlooked in these conversations. Strawberries, in particular, have a moderate acidity that can bother some people, especially when eaten in large amounts or paired with acidic dairy products like yogurt with citrus flavoring. Blueberries and blackberries tend to be gentler, though individual tolerance varies significantly from person to person. This is an important point to underline. GERD triggers are not perfectly identical across every patient. There are well-established patterns based on acidity and composition, but your own esophagus, your own LES function, and your own eating habits create a personal profile that may differ slightly from the textbook list. This is part of why tracking your own symptoms in relation to specific foods, rather than relying purely on general lists, tends to produce the most useful and personalized results. Dried fruit is another category worth mentioning, because it is often marketed as a convenient, healthy snack, when in reality the concentration process used to dry fruit also concentrates its sugar and acid content into a much smaller volume. A handful of dried apricots or dried mango can deliver a surprisingly intense acid and sugar load compared to eating the same fruit fresh. People often eat dried fruit in larger quantities than they realize, simply because it is easy to snack on without much awareness, which compounds both the acidity and the pressure issues we just discussed. So what does this mean practically? It does not mean you need to eliminate fruit from your diet entirely. Fruit provides fiber, vitamins, and antioxidants that genuinely matter for long-term health. An unnecessary restriction often creates more problems than it solves, including nutritional gaps and an unhealthy relationship with food. What it does mean is that fruit selection, timing, and portion size deserve the same level of attention that people with reflux already give to obvious culprits like coffee, alcohol, or fried food. Bananas, melons, and papaya tend to be among the gentler options, with lower acidity and a composition that most people with reflux tolerate well. These can serve as reasonable substitutes when you're craving something fresh but want to reduce your risk during a flare-up. Timing also plays a critical role that often gets ignored. Eating any acidic fruit on a completely empty stomach, first thing in the morning, tends to be more provocative than eating that same fruit after a meal, when there is already some food present to buffer the acidity and slow gastric emptying. Similarly, eating fruit within 2 to 3 hours of lying down, whether for a nap or for bed, removes the natural advantage that gravity provides in keeping stomach contents where they belong. Many people who report nighttime reflux symptoms can trace at least part of the problem back to a piece of fruit eaten too close to bedtime, even when that fruit would have been perfectly tolerable earlier in the day. If you are watching this and starting to recognize your own habits in what we have described, you are definitely not alone, and that recognition is actually the first real step toward managing this condition more effectively. I would genuinely like to know more about who is watching this and dealing with this same situation, so take a moment and drop a comment letting me know which city or country you're watching from right now. It helps me understand just how widespread this confusion really is, and it helps other viewers in the comments realize that this is a far more common experience than they probably assumed. Let's also address something that comes up constantly in questions from people managing reflux, which is whether cooking or processing a fruit changes its impact. In general, cooking can reduce some of the raw acidity perception in certain fruits, but it does not eliminate the underlying acid content. And in the case of tomatoes, cooking actually concentrates the acidity as water evaporates during the process, which is part of why tomato sauce tends to be more provocative than a fresh, raw tomato slice. This is an important nuance because many people assume that cooked equals gentler across the board, and that assumption does not hold consistently across every type of fruit. Let's also talk about smoothies specifically, because they deserve their own mention rather than being grouped in with whole fruit in general. A smoothie often combines several acidic fruits at once, strips away some of the natural fiber structure through blending, and is consumed quickly in a concentrated liquid form, often on an empty stomach in the morning. Pineapple, citrus, and even strawberries blended together create a beverage with a cumulative acid load that is considerably higher than eating any one of those fruits on its own. The speed at which a smoothie is consumed also matters. Drinking a large volume quickly gives your stomach less time to adjust, compared to eating the same fruits slowly over the course of a meal. None of this means smoothies are forbidden, but it does mean that if you have noticed reflux symptoms tend to be worse on smoothie mornings, this combination effect is very likely part of the explanation, rather than any single ingredient acting alone. It is also worth addressing combination effects, because reflux rarely happens because of a single isolated food. If you eat a moderately acidic fruit alongside coffee, a carbonated drink, or a heavy, fatty meal, the combined effect on your LES and on your stomach's acid production can be significantly greater than any one of those foods alone. Fat, in particular, slows gastric emptying, which means food and acid remain in the stomach longer, increasing the window of opportunity for reflux to occur. So a fruit that might be perfectly fine on its own, eaten as a standalone snack, can become a meaningful trigger when it is the final addition to an already heavy, acidic, or fatty meal. Understanding your own pattern usually requires a short period of deliberate observation. Keeping a simple log for a week or two, noting what you ate, roughly how much, and when symptoms appeared relative to that meal, tends to reveal patterns that are easy to miss in the moment. Many patients are surprised to discover that their trigger is not the fruit they suspected, but a specific combination, a specific time of day, or a specific portion size. This kind of personal data is far more useful for long-term management than any generic list because it reflects how your particular digestive system responds, rather than how an average person responds in a clinical study. Medical treatment for GERD typically follows a layered approach, and lifestyle and dietary adjustments, including thoughtful fruit choices, sit at the foundation of that approach rather than as an afterthought. For many patients, addressing diet, meal timing, body position after eating, and weight management produces meaningful improvement on its own. For others, especially those with more frequent or more severe symptoms, medical treatment becomes necessary alongside these lifestyle changes. Medications that reduce stomach acid production are commonly used under medical supervision, and they can be highly effective, but they work best when paired with the kind of dietary awareness we have been discussing, rather than used as a replacement for it. Relying purely on medication while continuing daily habits that provoke reflux tends to produce inconsistent results and can mask a problem that deserves more direct attention. This brings us to an important safety point that deserves serious attention rather than being treated as a footnote. If your reflux symptoms are frequent, if they're worsening over time, if you experience difficulty swallowing, unintended weight loss, persistent chest pain, or symptoms that wake you up regularly at night, these are signals that go beyond what dietary adjustment alone can or should address. These can indicate complications of long-term reflux, including esophagitis or, in some cases, more serious conditions that require proper medical evaluation, including endoscopic examination. Self-managing through diet alone, while ignoring these warning signs, is one of the more dangerous mistakes people make, often because they assume that as long as they avoid their trigger foods, the underlying issue is being handled. Diet can meaningfully reduce the frequency and intensity of symptoms, but it cannot substitute for proper diagnosis when warning signs are present. If any of this sounds familiar to you, treat it as a clear signal to schedule an appointment with a physician rather than continuing to adjust your diet on your own indefinitely. Now, if you've stayed with me through all of this, you clearly take your health seriously, and that is exactly the kind of audience this channel is built for. I would genuinely appreciate it if you subscribed and hit the like button before continuing, because it directly supports the kind of careful, evidence-based explanation we just went through rather than the oversimplified advice that circulates so widely online. It only takes a second, and it makes a real difference for this channel. Let's bring this back to a practical framework you can actually use this week. First, identify the specific fruits in your current routine that carry higher acidity, particularly citrus fruits, tomatoes, and pineapple, and pay closer attention to how you feel in the hours after eating them. Rather than assuming an immediate reaction or no reaction at all means they are safe. Second, consider portion and timing as seriously as you consider the fruit itself. A small serving after a meal behaves very differently in your body than a large serving on an empty stomach or right before lying down. Third, Look toward gentler alternatives like banana, melon, and papaya when you want fruit during a period of active symptoms, without feeling like you need to eliminate fruit altogether on a long-term basis. Fourth, pay attention to combinations, especially fruit paired with coffee, carbonated drinks, or heavy, fatty meals, since the combined effect is often more significant than any single food in isolation. None of this is about fear or restriction for its own sake. It is about precision. Reflux management improves dramatically when you stop treating food as simply good or bad and start understanding the actual mechanisms at play, the acidity, the pressure, the timing, and the LES function that ties all of it together. Fruit is not your enemy, but blind trust in fruit, simply because it carries a healthy reputation, can absolutely work against you if you're not paying attention to how your specific body responds. The central lesson today is straightforward. Not all fruit affects reflux the same way. Acidity and composition matter enormously, and even fruits with excellent reputations, like grapefruit or pineapple, can be meaningful triggers depending on quantity, timing, and what they are paired with. Awareness of these specific mechanisms, rather than vague dietary fear, is what actually allows you to keep enjoying fruit while reducing your symptoms in a sustainable way. And if your symptoms persist despite these adjustments, or if you notice any of the warning signs we discussed, that is the moment to involve a physician directly rather than continuing to experiment alone. There's a lot more to understand about how everyday habits quietly influence reflux well beyond what we covered today, and we will continue building on this same foundation in the next video on this channel. If today's explanation gave you a clearer picture of something you have been struggling to understand, there is more waiting for you here, and I will see you in the next one.